The Lagos State government has clarified its position on reopening of event centres, explaining that owners of such places across the state must register their facilities pending issuance of further directives by the state governor. The Commissioner for Tourism, Arts and Culture, Mrs. Uzmat Akimbie Yusuf, made the clarification following media reports of event centres opening for operations. She explained that the state government is yet to make any declaration on the date for reopening, adding that the governor will make a pronouncement provided the event centres have met all laid down procedures, including registering under the Register to Open initiative of the state government. And as the world grapples with COVID-19, as we try to get our lives back to normal and minimize social disruptions, also the negative humanitarian consequences, we have Dr. Emil Cohn. He gives us some idea of what we're getting back into. She's also a public health physician. Thank you for joining us on the program.
Thank you. Thank you, Millicent.
All right, Dr. Cohn, we're hearing behavioral changes that we need to make. How are we achieving this? What have you noticed as a public health physician in Lagos?
Okay, so before you can have a behavioral change, you must have information. So a lot of awareness being created, especially by NCDC and all the health team, rapid response team, risk communication on precautionary measures. So you need to know first before you can act on it. So it's a bit worrisome that people are still doubting the existence of COVID-19. However, the risk communication is working hard to make sure that information gets to the right places so that people can do the things they're supposed to do, the hand washing, especially the face mask thing. I see the way people use face masks. They turn it into chin mask, they turn it into just mouth mask, beneath the nose, thrills and all that. We call this a respiratory infection. So you know that the droplets can come through the nose, through the mouth. So by the time you put it on the chin, what exactly are you using that mask for? So we still have a lot of work to do emphasizing these things. I know behavioral change doesn't come all of a sudden. It's a gradual thing. It's not easy for somebody that has been used to just moving around, hugging people and all that, for you to now tell the person, no, don't hug, don't shake, use hand sanitizers every time, and especially that face mask time. Some people, especially with some cloth materials that are being used for the face mask, sometimes it could be a bit suffocating and people find it difficult to use. So these changes need time, but we need to still keep emphasizing, you know, positive reinforcement until we get there, because COVID-19 is here and it's real and we really need to be precautionate.
I wanted to get your thoughts on the new study that suggests diarrhea may actually play an important role in community transmission. Do you think that is also what we're witnessing here?
Well, it's still the respiratory tract that is more common as a means of transmission. However, we don't throw away that because people have come down with diarrhea. You know, initially when we had case definitions, we just had respiratory symptoms, cough, breathlessness, and all that. It was later that we had general body weakness and diarrhea. So in places where open defecation is still being practiced or improper sanitation, people dispose of, people go to use the toilets and they don't do the proper hand washing thing. You know, you need to wash the hand very well for minimum of 20 seconds and all that. People just wash it in the jiffy. Some people even just use ordinary water without application of soap. You wonder how far that would go. So in occasions like that, well, it can actually happen. But we still know that it's the respiratory tract that is the most common means of transmission.
In terms of how we can curb this, do you think that we're still facing stigmatization? And this is on the part of people who stigmatize others who have survived, who have recovered, or perhaps health workers who are on the front lines?
Yes, it's still happening. The stigmatization is there. And I really need for people to know that this disease, COVID-19, is a disease that respects no race, no gender, and even class. Big men have gotten it, poor men have gotten it, health workers have gotten it. And I wonder why some people still think it's not real. Why would a health worker pretend that he's ill and he has COVID-19, go to the isolation center and get treated and come out? After all, the the people that are even stigmatizing, they are the ones that the COVID-19 patients that have recovered should even be running away from. Because we've not gotten that confirmation that it confers live immunity. So if there's still that chance of reinfection, then they actually should be the ones running away from these people, stigmatizing them. So I'd advocate that please let us be careful, let us accommodate others, because this disease knows no difference, no race. It's a classless disease and it can affect anybody anywhere.
Right. Thank you so much, Dr. Emel Kon, public health physician. We understand it's your birthday today. Happy birthday to you. Thank you for joining us.
Thank you very much.